Autism and bipolar disorder. How are they connected? Understanding autism and bipolar disorder. To gain a comprehensive understanding of the complex relationship between autism and bipolar disorder, it is essential to first grasp the individual conditions and their co-occurrence. What is autism? Autism is a neurodevelopmental disorder characterized by challenges in social interaction, communication difficulties, and restricted and repetitive patterns of behavior. Individuals with autism may exhibit a wide range of symptoms, from mild to severe, which can impact their daily functioning and social relationships. Autism is often diagnosed in early childhood, but it is important to recognize that it can persist throughout adulthood. What is bipolar disorder? Bipolar disorder, also known as manic depressive illness, is a mood disorder that involves extreme shifts in mood, energy levels, and activity. Individuals with bipolar disorder experience episodes of mania or hypomania, characterized by elevated mood, increased energy, and impulsivity. These episodes are typically followed by periods of depression, marked by feelings of sadness, lethargy, and hopelessness. Bipolar disorder can have a significant impact on an individual's day-to-day life and relationships. ANN. Co-occurrence of autism and bipolar disorder. Research has shown that there is an increased likelihood of co-occurrence between autism and bipolar disorder. While the exact relationship between the two conditions is still being explored, studies have suggested that they may share some underlying genetic and neurobiological factors. It is important to note that not all individuals with autism will develop bipolar disorder and vice versa. However, the presence of both conditions can present unique challenges and complexities in diagnosis and treatment. By understanding the individual characteristics of autism and bipolar disorder, as well as their co-occurrence, we can better comprehend the complexities and unique needs of individuals who experience both conditions. This knowledge is crucial for diagnosis, treatment, and support strategies for individuals with autism and bipolar disorder. Autism in adults. Autism is a neurodevelopmental condition that affects individuals across their lifespan. While often associated with childhood, autism can also be present in adulthood. Recognizing autism in adulthood can be a crucial step in understanding oneself and accessing appropriate support and resources. In this section, we will explore recognizing autism in adulthood and discuss some common challenges and symptoms experienced by adults with autism. Recognizing autism in adulthood. Recognizing autism in adulthood can be complex, as the signs and symptoms may manifest differently compared to childhood. Some individuals may have been undiagnosed or misdiagnosed during their earlier years. It's important to remember that autism is a spectrum, and individuals may exhibit a wide range of characteristics and strengths. Adults with autism may find it challenging to navigate social interactions, and may experience difficulties in understanding and responding to social cues. They may have a preference for routines and sameness, and may become overwhelmed by changes in their environment. Sensory sensitivities, such as sensitivity to noise or touch, are also common among adults with autism. Additionally, adults with autism may have intense, focused interests in specific topics or activities. They may demonstrate exceptional attention to detail, and show strengths in areas such as problem solving, pattern recognition, and logical reasoning. Common challenges and symptoms. While the characteristics of autism can vary from person to person, there are some common challenges and symptoms that adults with autism may experience. These include social difficulties. Adults with autism may find it challenging to initiate and maintain social relationships. They may struggle with understanding nonverbal communication cues, such as facial expressions and body language. Difficulties in empathy and perspective taking can also contribute to social challenges. Communication differences. Some adults with autism may have difficulty with verbal and nonverbal communication. They may have trouble initiating conversations, understanding abstract language, or interpreting sarcasm and humor. Others may have a rich vocabulary and speak fluently, but struggle with pragmatic language skills, such as turn-taking and maintaining a topic of conversation. Sensory sensitivities. Many adults with autism have heightened sensitivity to sensory stimuli. They may be oversensitive or undersensitive to certain sounds, lights, textures, or smells. These sensitivities can impact their daily lives and may cause discomfort or distress. Rigid thinking and resistance to change. Adults with autism often prefer routines and predictability. They may become anxious or upset when changes occur in their environment or daily routines. Flexibility and adapting to unexpected situations may be challenging for them. Special interests. Adults with autism may have intense and focused interests in specific topics or activities. They may spend significant time and energy pursuing these interests, and have extensive knowledge in their chosen areas. Recognizing the signs and symptoms of autism in adulthood is crucial for understanding oneself and seeking appropriate support. If you suspect that you or someone you know may be autistic, it is recommended to consult with a healthcare professional or seek a comprehensive evaluation for an accurate diagnosis. Bipolar disorder in adults. Bipolar disorder, a complex mental health condition, can also affect adults. It is essential to recognize the signs and symptoms of bipolar disorder in adulthood to ensure proper diagnosis and treatment. Let's delve into the topic further. Recognizing bipolar disorder in adulthood. Bipolar disorder can manifest differently in adults compared to children or adolescents. As individuals with autism may already face challenges in expressing their emotions, it can be more challenging to identify bipolar disorder symptoms in this population. Some common signs of bipolar disorder in adults include mood episodes. Adults with bipolar disorder may experience episodes of intense mood swings, ranging from depressive episodes characterized by feelings of sadness, hopelessness, and lack of interest, to manic episodes characterized by elevated mood, increased energy levels, and impulsive behavior. Sleep disturbances. Adults with bipolar disorder may experience changes in their sleep patterns, such as insomnia during manic episodes, or excessive sleep during depressive episodes. Changes in activity levels. During manic episodes, adults with bipolar disorder may engage in excessive activity, such as taking on multiple projects simultaneously or engaging in risky behaviors. Conversely, during depressive episodes, individuals may experience a significant decrease in energy levels and motivation. Shifts in behavior and thinking. Adults with bipolar disorder may exhibit rapid or pressured speech, racing thoughts, distractibility, and difficulty concentrating during manic episodes. They may also struggle with decision-making and experience a loss of interest or pleasure in activities during depressive episodes. If you or someone you know is experiencing these symptoms, it is crucial to consult a healthcare professional for a comprehensive evaluation. Common challenges and symptoms. Adults with bipolar disorder often face various challenges that can significantly impact their daily lives. Some common challenges and symptoms associated with bipolar disorder in adults include challenges and symptoms: unpredictable mood swings, difficulty maintaining stable relationships, impaired work or academic performance, substance abuse, suicidal thoughts or behaviors, financial difficulties, problems with self-esteem. These challenges can be further compounded when individuals with autism have co-occurring bipolar disorder. It is essential to address these challenges through appropriate support and treatment. Recognizing the signs and symptoms of bipolar disorder in adults is crucial to ensure timely intervention and support. If you suspect that you or someone you know may have bipolar disorder, it is recommended to seek professional help for an accurate diagnosis and to develop an appropriate treatment plan. Remember, you are not alone, and with the right support, managing bipolar disorder is possible. Overlapping features and challenges. As we explore the relationship between autism and bipolar disorder in adults, it's important to understand the shared characteristics and unique challenges that individuals with co-occurring autism and bipolar disorder may face. Shared characteristics of autism and bipolar disorder. Autism and bipolar disorder are distinct conditions with their own diagnostic criteria and characteristics. However, they do share some common features that can sometimes make it challenging to differentiate between the two. Social difficulties. Both autism and bipolar disorder can involve difficulties in social interactions and communication. Individuals may struggle with understanding social cues, maintaining eye contact, and forming meaningful relationships. Sensory sensitivities. Sensory sensitivities can be present in both autism and bipolar disorder. Individuals may experience heightened sensitivity to certain sounds, lights, textures, or smells, which can lead to discomfort or distress. Rigidity and repetitive behaviors. Both conditions can involve repetitive behaviors or routines. This can manifest as rigid adherence to rituals or difficulties adapting to change. Emotional dysregulation. People with autism and bipolar disorder may experience challenges in regulating their emotions. They may have intense emotional reactions, difficulty managing stress, and frequent mood swings. It's important to note that while there are shared characteristics, the underlying causes and nuances of these features may differ between autism and bipolar disorder. Unique challenges faced by individuals with co-occurring autism and bipolar disorder. Having both autism and bipolar disorder can present additional complexities and challenges for individuals. The combination of these conditions can lead to unique experiences and difficulties, which require specialized attention and support. Diagnostic challenges. Identifying and diagnosing co-occurring autism and bipolar disorder can be complex. The overlapping symptoms and shared characteristics can make it difficult to differentiate between the two conditions. Accurate diagnosis often requires a comprehensive evaluation by a qualified healthcare professional. Treatment considerations. Individuals with co-occurring autism and bipolar disorder may require tailored treatment approaches that address both conditions simultaneously. This can involve a combination of medication management, therapy, and behavioral interventions. Treatment plans should be individualized to meet the unique needs of each person. Increased vulnerability. The presence of both autism and bipolar disorder can make individuals more vulnerable to certain challenges. This includes difficulties in social situations, increased risk of self-harm or suicidal ideation, and potential exacerbation of symptoms during manic or depressive episodes. It is crucial to provide a supportive environment and access to appropriate resources to help individuals navigate these challenges. Understanding the shared characteristics and unique challenges of co-occurring autism and bipolar disorder is essential for individuals, caregivers, and healthcare professionals. By recognizing these factors, we can better support and advocate for those who experience the intersection of these two conditions. Seeking support and treatment. For individuals with co-occurring autism and bipolar disorder, seeking appropriate support and treatment is essential. This section will discuss the diagnostic process and evaluation, various treatment approaches, and provide information on supportive resources and strategies. Diagnostic process and evaluation. Obtaining an accurate diagnosis for co-occurring autism and bipolar disorder can be complex. Due to overlapping symptoms and challenges, it is crucial to consult with a qualified healthcare professional experienced in diagnosing and treating both conditions. The diagnostic process may involve a comprehensive evaluation that considers the individual's developmental history, behavior patterns, and clinical interviews. Diagnostic tools such as the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, are often used to assess the presence of autism and bipolar disorder symptoms. These criteria help clinicians form a more accurate diagnosis and guide appropriate treatment planning. However, it's important to note that the diagnostic process may vary depending on the healthcare provider and their expertise. Treatment approaches for co-occurring autism and bipolar disorder. Treating co-occurring autism and bipolar disorder requires an individualized approach that addresses the unique needs of each person. Treatment typically involves a combination of medication, therapy, and supportive interventions. Here are some common treatment approaches. Medication prescribed by a psychiatrist can help manage the symptoms associated with bipolar disorder, such as mood swings and irritability. However, it is important to work closely with a healthcare professional to find the right medication and dosage, considering potential interactions and side effects. Therapy. Different types of therapy can be beneficial for individuals with co-occurring autism and bipolar disorder. Cognitive behavioral therapy, CBT, can help individuals develop coping strategies, manage emotions, and improve problem-solving skills. Social skills training and psychoeducation can also be valuable in enhancing social interactions and understanding the conditions better. Supportive interventions, supportive resources, and strategies play a crucial role in managing co-occurring autism and bipolar disorder. These may include implementing a structured routine, utilizing visual supports, engaging in self-care activities, and accessing community support groups. Identifying and implementing strategies that work best for the individual can greatly improve their overall well-being. Supportive resources and strategies. Living with co-occurring autism and bipolar disorder can present unique challenges. Fortunately, there are various supportive resources and strategies available to help individuals manage their conditions effectively. These can include support groups. Connecting with others who share similar experiences can provide a sense of community and understanding. Support groups, both in person and online, offer a platform to share experiences, gain insights, and learn from others facing similar challenges. Self-care practices. Encouraging and prioritizing self-care activities can enhance overall well-being. Engaging in activities such as exercise, mindfulness, and hobbies can help reduce stress, manage emotions, and promote a healthier lifestyle. Educational resources. Accessing reliable educational resources and information about autism and bipolar disorder can increase understanding and empower individuals to make informed decisions about their treatment and daily routines. Remember, each individual's journey with co-occurring autism and bipolar disorder is unique, and it is essential to consult with healthcare professionals to create a comprehensive and personalized treatment plan. By seeking appropriate support, understanding the diagnostic process, exploring treatment options, and implementing supportive resources and strategies, individuals with co-occurring autism and bipolar disorder can lead fulfilling and meaningful lives. Conclusion. Autism and bipolar disorder are two complex conditions that can be challenging to manage on their own, let alone together. However, with the right treatment and support, it is possible to live a fulfilling life with both conditions. If you or someone you love is struggling with autism and bipolar disorder, don't hesitate to reach out for help. You are not alone, and there is hope for a better tomorrow.